Hello, lovely. How are you? Good. Welcome to Brave Skin Clinic. I'm Nicola and I'll be carrying out your skin consultation and assessment today. Nice to have you here. Right, I just need to clarify a few personal details, okay? Okay, can I get you to just confirm your name? Okay. Date of birth? Okay. First line of your address? Postcode? Okay, and finally just a contact number. Good, that's fine. And I believe this is your first time here. Great. Do you have the medical questionnaire to hand? You do? Great. Can I just take that from you? Okay, let's put that there. Just have a brief look through, okay? So, good. Okay, good. Okay, okay, that's perfect. Okay, fantastic. What's your occupation? Okay. Good. Right. I'll probably ask you a couple of things during the assessment. Okay. I'm not going to ask you anything else at the moment. Okay. So, first things first, are you wearing any products on your face at the moment? Any makeup, skincare, or anything like that? Great, I'm good. Just wanted to check. Okay, so I'm going to pop my gloves on. Okay. So, how are you? Great. I'm glad to hear that. So, how's your sleep? Would you say you're getting the right amount of sleep? Okay. Are we getting enough water? If you could try to make sure you are drinking a lot of water throughout the day, definitely fluids, but try to refrain from too much caffeine. Okay, we need to keep you hydrated inside and out. Okay, what about your food intake? How's that? Okay, that's fine. Good. Do you smoke, drink, or anything like that? Okay, and what are your main concerns with your skin? Okay, so dark circles. Okay, fine lines. And even skin tone. Okay. Okay, I get the idea of your concerns. Alright, I will obviously have a thorough look today for you. Okay, good. So I'm happy with that, but do you use sunbeds? Do you sunbathe a lot? Do you use an SPF at all? Okay, please make sure that you are wearing an SPF on your face at least. Okay, that's really important. Okay, do you burn easily? Go quite red, or any oiliness, flaking, dry patches, spots, blackheads, any acne? Okay, so you've possibly got some scarring from years ago. Okay, that's fine, I'll have a look. Good, I'm happy. So, we can begin. I'm going to start off by taking a swab, okay, of your face. Okay. So I have the swab. Okay. 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 I've got a good amount. Okay. Wonderful. Okay, to date, time that. Okay, good. Excellent. Right, I'm now going to have a look at your face without actually touching. Okay. Okay. Yes, I can see the scarring there that you were talking about. And that side too. Okay. Okay. I'm going to just look under your jaw. You just tilt your head back slightly. Thank you. Okay. And back. Okay. That's great. Perfect. I'm now going to just obviously have a really good look now. Okay. Okay. I'm just having a feel at the moment to see if I can feel any lumps or bumps. You're right. Okay. quite smooth, I can't feel anything. Good. Good. I'm just seeing what your elasticity is like. Okay. Good. Feels quite supple. Good bounce to the skin. Okay. Which is always a plus. Okay. Right. I'm just going to start now by having a really good look at your nose. Okay. So I can see quite a few blackheads down the centre of the nose. Okay. And quite a large one on the tip of your nose. We could definitely remove that. And here we could do with a little bit of extraction too. I'm just going to do a little bit of squeezing. Do that, they come quite to the surface, so I think that they would be quite easy to remove. Okay. Yeah, and some of the pores are actually quite large, and the dirt is obviously going in there and it's getting wedged in. Okay, so a few large pores there. Okay. Looking at the side of your nose, it appears fine. See a slight shine down the centre of your nose, which goes in between your brows. Okay, is that always there? Okay, so at what times would you say? Okay, so when you've got no products on and afternoon time. Okay, so potentially then we could be just showing signs of dehydration. Okay, it's quite common. But we can definitely work on those blackheads there. And between the brows you have some enlarged pores as well, and some blackheads there. Let me just have a look. Oh yes, they'll easily be extracted, not a problem. Same as your nose. We can definitely work on the enlarged pores as well. Good. Do you wax, tweeze, thread or anything? Yeah, because I can see some discoloration and that's usually from waxing and things like that. Okay, so it appears a lot lighter in colour. Okay, how often do you wax? Okay. Good. Can you close your eyes for me? Okay. Just stretching your lids. Okay. Just gently rub. Okay, so on your eyelids I can see a lot of excess skin, so I mean when I stretch it there's still quite a lot there, so it's quite stretchy. Okay, and that does happen as we do get older. Okay, so it's always worth making sure that you use an eye serum, okay, all over, and eye cream. Some eye creams you can actually put on your lids, okay, and that'll just help firm it up a little bit. Okay, we just need to make sure that they are keeping hydrated. Because when we put on makeup, that's when you can see gathering and things like that. Okay, I mean it's not necessarily an issue, it's just, you know, a personal thing or not. Okay. Okay, so just having a look where we usually get crow's feet. Okay. It's quite good there. Not really any issues. Same, that's good. Okay. Okay, so I know you said you're concerned about dark circles. I'm just going to have a really good look now. Okay, so under here is quite thin. Okay, it's quite thin anyway, but yours is quite thin. Alright, and it's sort of quite indented, if that makes sense. So it just means it's a lot deeper. Alright, and obviously a lot of dark circles can appear through just shadowing. Alright, sometimes we can get dark circles if we haven't washed our makeup off correctly and it starts gathering. Okay, sometimes it's dehydration, lack of sleep, and all those things. Okay, some people are just more naturally prone to it, but there is things that we could do to help. Okay, but I'll discuss things with you afterwards. You can see it's quite a lot there. Okay, my love. I'm just going to try and do that. Yeah, see that's very delicate, very thin area. Okay. So quite close to your eye, I can see lines, okay? Now these aren't deep lines. They are dehydration lines, believe it or not, okay? So some people think they're getting wrinkles, and it's actually not wrinkles, okay? So obviously it's about having your water intake, but it's about getting that hydration back into your skin, okay, which is really, really important. So having a serum is definitely needed, okay, in the eye area. That will help reduce that, and then an eye cream really help. And simple drainage massages are really good. I mean, you can do things yourself, okay, so like tapping, circles, outwards, like so, okay, and that's really good when you put on your serums and eye creams. You can really give it a good massage, okay. I'm just going to have a little go of that for you now. Okay, I'll start this side so you can sort of see what I mean. Okay. Make sure you're nice and gentle. Okay, so just like that. Okay, good. Okay, moving on to the cheek. Slight bit of pigmentation. I can see all this scarring, as I said before. Okay. So we've got quite some indents there where you had the acne. Okay, did you used to pick a lot? Yeah. So we could do with resurfacing that area. And same here, we can do with resurfacing the skin here to help smooth it out and reduce the scarring and the bumps. Okay. Other than that, your skin on your cheek area is actually really good. Okay. And I know scarring can become an issue for some people. Mm-hmm. No blackheads. I go like that, I can see how quite down, what we used to call craters, you know. Yeah. They're not particularly obvious, but because I'm really looking, obviously I can see. But feeling over it, it doesn't feel rough, it doesn't feel bumpy, okay, so it's more of a how it appears. So we could do with, obviously, doing some resurfacing treatments, maybe something like certain peels, microdermabrasion, okay, just different things like that. Okay. Just going to go onto your forehead. I'm squeezing, you can see line across, which is dehydration. Okay, quite a lot. I'm squeezing like so, and lines come, dehydration lines. Okay. Okay. Your forehead is very smooth, okay. Very clear. No oiliness or dryness or anything here. Can you just scrunch your face for me? Okay, relax. Can you just smile? Okay, relax. You just raise your brows for me. Okay, relax. Good. Looks great. Okay, relax. I'm just going to look in your chin area, okay? And upper lip. Do you wax your lip or chin at all? Okay. Okay, a few enlarged pores here, blackheads. And just squeeze. Yeah, we could probably remove them. So it seems a couple of stubborn ones, but potentially steam. Okay, just pout for me. Hold it. Okay, relax. Smile. Okay. Scrunch your face for me. Okay, relax. Have a look at your lips. Okay, appear quite dry. Do you ever get cold sores or anything? Okay. Do you wear a lip balm? Or... Okay, make sure you don't use any that are extra drying, okay? So try to avoid anything with petroleum in it, really, because sometimes that can have a reverse effect and you keep feeling like you need it, so you're putting more on. Yeah. Squeeze your lips. Nice. Squeeze them and they look good. I'm just going to feel your face and the elasticity of it, okay? Very supple. Good bounce. Happy with that. to have a look with my light, okay? That's good because I can really see the blackheads now. The enlarged pores. Close your eyes for me. Yeah. Okay, you can open if you wish. I'm looking where your eye contour is, okay? I can really see these dark circles. Not really, like I said, crow's feet or anything like that. Them lines are obvious with the lights on. The lines on your eyes. Okay. Look at your cheek. Okay, yes. Scars and dents need to be definitely worked on that. That'd be good. It all just depends on how you feel about them, really. And I know you said that's quite concerning for you. So, okay. We could do some laser treatment. That wouldn't be an issue. Check down the side of your face, round by your jawline. Tilt your head for me. Okay. Alright, my love, you just relax for me, okay? I'm just going to jot a couple of notes. Okay. Good. Just jotting everything down. Okay, it's important so we have this on your records. Okay. Good. Excellent. Let's make sure we're getting enough sleep as well. That can really affect our skin. Obviously, diet. Okay, stress levels. Okay. Getting a lot of fresh air would be great, but we need to make sure that we are using a good moisturiser to protect it as a barrier, because any wind and things like that can damage the skin. Okay, and obviously an SPF. Okay, so that's that. Okay, so I'm just going to get a couple of cotton pads and I'm going to pop this special product on, okay? Just need to shake it, make sure it activates. You're quite comfortable, relaxed. Good. Okay, close your eyes for me. Thank you. Okay, just leave that to soak in. Okay, so how's that feel on your skin? Good. I'm just going to take another swab now. Okay. Okay. Wonderful. So I need to Date it. Time. Great. Okay. Right. How are you feeling at the moment about everything? Good. So I just want to go over a few things with you first. Okay. So I think you could benefit from regular drainage, massage, and just massage in general on your face, okay? Working on under the eye area, okay, forehead, and obviously all over, and really draining out any toxins, okay? That's definitely something I think we should work on. We can use a special facial serum to do that, or a special facial oil. Okay, so it's not going to add any oil to your skin as such, but it's really good hydration. Okay, I think we need to use hyaluronic acid products, and we also need to use probably a retinol product. Okay, there is all sorts of different types of products that we can actually use, and they all treat different things. Okay, I don't want to bombard your skin with too much too soon. Okay, we've got all sorts of different things, but one step at a time. Okay, so that's what I think's best, and I would recommend you having what we call a high strength facial, okay, which is where we can use the retinol products and hyaluronic acid, and then a couple of other products like zinc and things like that to add into your face, and glycolic and that. Okay, I feel like we need to add some caffeine products to your eye area to help reduce some of the dark circles. You need an eye serum for definite, you need a facial serum for definite as well. I feel like we need a good exfoliation, especially cheek area. Okay, I'm thinking some microdermabrasion on this area. Potentially we could go down the route of lasers. Okay, just on that section. There is a few more treatments we could do, dermabrasion, so it's a lot deeper than the microdermabrasion. Okay, but again, I don't want to put too much harsh products on your skin, okay, in your face. Okay, like I said earlier, we could do chemical peels, different peels. We need good masks, good hydration masks. Okay, we can use special sheet masks or other masks that we have, okay, which would be really nice for you to do. So I could probably write you out a kind of prescription kind of facial if you like, and I have a range of medicated products, high quality normal products and things like that. You won't find these products anywhere else, just in our skin clinic. Okay, so they are patented products, and I obviously have all worked really hard with the labs and things like that to get these products just right. Yeah, okay. I want to do extraction on your nose area, chin and here, so that's a definite must. Okay, we can work on those, and I can set you up a obviously facial program regime for at home. Okay, good. Are you using anything at the moment? Okay. How do you find that? Okay. I'm going to be using certain products, brightening products as well. I want to kind of even out your skin tone. There is slight differences in coloration. Okay, slight bit of pigmentation. Okay, which is easily worked on. We want to help hydration, tone the skin. We want to help firmness, any wrinkles, dark circles and things like that, which is basically what we've mentioned previously. So, and I would say that I think you need to come into the clinic at least once a month, okay? And multivitamins. Do you take any? Okay, well, we do some Brave supplements here, okay, and they are high strength multivitamins, okay, properly laboratory tested and things like that. They help work inside out, and obviously you get all your normal levels of things, but then we've added in certain things for the skin, collagen, biotin, and all sorts of different things that are really good for your skin. And we have omegas 3, 6 and 9 in there as well. Okay, good level of vitamin D, which is really going to help. Okay, good level of vitamin C and everything like that. Okay, and we have a subscription base, and it's on prescription base as well. And we work through, we can start you at the really high dose and work down, can work low to high and stuff like that. I'll have to go through those with you at a separate time if that was something you were interested in. You can just try any multivitamins and things like that that you can get over the counter, but if you wanted something a bit more targeted, I would definitely recommend these products to you. Yeah, that's right. But I can give you some information actually before you go. I will do that. Okay. Good. So we obviously do cosmetic surgery here in clinic. Okay, and we do Botox, fillers, all sorts of different treatments like that. I don't necessarily like to go down that route with my patients, okay, but obviously if the ladies and men want that, then obviously we have a consultation and we go ahead if we feel happy, okay. But I think something would be really good for you. I don't know what your thoughts on this, but it's a tear duct treatment, okay. So we inject some filler into here. It is a special product that helps lift slightly. You don't look stupid, don't worry. And it lifts it and evens it out. So that helps reduce any shadowing. Okay, it will raise it a little bit as well. It will obviously firm it out and help reduce any of the lines that are there. But it has a special illuminating product in it and it counteracts it, so it evens it out. You may have seen certain eye products with a product in there that will help it. It's like that, okay, and it can last about 9 months plus or something like that. That would be really good for you. I'll give you some information on that. Again, we don't have to go down that route at all, or you know, at first I would like you to try products and things like that and these facials and other things that we've got planned, but I can certainly do that for you, not a problem. Okay. Good. Okay. Wonderful. Do you have any questions for me at the moment? Okay. I'm just going to fill out this face mapping chart before you go. Okay. I also want to put on a UV light and have a look for any pigmentation, skin damage, wrinkles and things like that. Okay, and that will be the last thing that I will carry out on you today. Okay, so I'm just going to mark these areas on the face map. So the chin area. The corners. Nose area we have them too. Between the brows we have them too. And we have these scarring cheeks. Okay. We have the discoloration under the brows, and the eyelids. We have the excess stretchy skin. Some ladies like to have lifts and things like that to help even that out, but I don't like to go down that route, especially someone of your age. And I mean, your skin is beautiful, and I wouldn't really want to start adjusting face and things like that, okay, unless it's something obviously you really wanted me to go down. But yeah, I think that's very sensible. Okay, but I have to mention the options. Okay, that's good. So, forehead, dehydration. Okay, and we have under eyes, we have the dark circles. Okay. Pigmentation, forehead. Okay. Then we have the dehydration lines, the eyes as well. Okay, let's go there. Okay, that's good. Okay. Fantastic. Good. Okay, if you wouldn't mind just popping on the goggles that are on that table next to you, please. Okay, I'm now going to dim the light. Okay, your goggles in position. Good. So, I'm now going to set the UV light on. Okay. Okay, it's taking pictures. Turn your head to the left, please. To the right. Pop your head down to your chest. And bend your head backwards. And back normal. Okay. Can you scrunch your face? Okay. Relax. Okay. Nearly done now. Okay, I'm just going to prune that. just wait for that to process. I'm going to get you the information leaflets, okay? All right. Good. All done. If you wouldn't mind removing your goggles, and I'm now going to turn the light back on. Just let your eyes adjust. Great. Right, so here is the information on the tear duct procedure. Okay. Information here on the laser treatment. Okay. Information here on the dermabrasion and microdermabrasion. Okay. Okay, so I will have to write that up, really assess it and do the report. Okay, you have the information leaflets that no, I didn't give you the vitamin one, did I? There we go. That's the vitamins information. Okay, so then I want to put together a regime for clinic. Okay, then I would like to put together one for home. Okay, and then we can have a chat about what we'd like to work on, what procedures you'd like, etc. Okay, does that sound good? Okay, I'll let you go away and have a drink of some water, have a think about what you want to do, and go ahead. All right, don't feel pressured into anything. Okay, good. Oh, you are very welcome. I'm really glad to be able to help you. All right. Okay, my lovely. All right. Well, you have a lovely week. Okay, and hopefully I get to see you in a few weeks. Okay. Yeah, we can go through payment options and things like that for you, don't worry. Okay, my lovely. You take care now. Bye-bye.